Imran Khan, age 74 years, reported reduced vision in his right eye. A senior and a qualified ophthalmologist from PIMS Islamabad conducted a complete eye assessment at Adiala Jail, including slit lamp examination, fundoscopy, intraocular pressure measurement, essential laboratory tests, and OCT, that is optical coherence tomography of the retina. Based on this assessment, a diagnosis of right central retinal vein occlusion was made and a hospital-based follow-up treatment was recommended. Accordingly, Mr. Niazi was brought to PIMS on the night of last Sunday for the advised procedure. At the hospital, the treatment plan, that is need for administering anti-VEGF intravitreal injection, was explained in full to the patient. The procedure was carried out in the operation theatre under standard sterile protocol and monitoring. It was completed smoothly in approximately 20 minutes. During the treatment, the patient remained vitally stable and was discharged with routine post-procedure care, instructions, and follow-up advice and the document.